Have you ever been lying in bed, completely still, and suddenly your heart starts pounding like you just ran up a flight of stairs? No warning, no exercise, no obvious reason. And because it happens at night, when the house is quiet and your mind has nowhere else to go, one thought appears immediately. Is something wrong with my heart? I'm Dr. Ryan Mitchell, and today I want to walk you through what nighttime heart racing can mean after 50. Not to frighten you, but to help you recognize the difference between a harmless trigger and a signal your body may be asking you not to ignore. Because the truth is, a racing heart at night is not always a heart attack. It is not always anxiety, and it is not always dangerous. But after 50, it deserves more respect. The reason is simple. As we age, the heart's electrical system, blood vessels, hormones, sleep quality, metabolism, and nervous system all change. The same pounding heartbeat that might have been caused by stress or caffeine at 35 may carry a different meaning at 55, 65, or 75. And here is where most people get misled. They assume the heart races because something suddenly happened in the heart. But very often the heart is only the messenger. The real signal may be coming from your breathing, your blood sugar, your thyroid, your sleep, your medications, your stress hormones, or even from silent inflammation that has been building for years. So let's slow this down and make sense of it. A palpitation is the feeling that your heart is pounding, fluttering, skipping, flipping, or racing. Sometimes it lasts only a few seconds. Sometimes it comes in waves. Sometimes it feels like one hard thump in the chest, and sometimes it feels like the heart is running away from you. At night, this can feel especially intense because your body is finally quiet. During the day, you are distracted by conversations, traffic, food, work, chores, and movement. But when you lie down, the nervous system becomes easier to notice. Your chest may press differently against the mattress. Blood flow shifts. Your ears may pick up the pulse in your neck or head. And suddenly, a heartbeat that was always there feels louder. But that's only the surface explanation. The deeper question is this: why is the heart becoming louder in the first place? The first hidden signal is your nervous system. Your heart is not just a pump. It is an electrical organ controlled moment by your autonomic nervous system. That means the automatic control system that adjusts heart rate, blood pressure, digestion, breathing, sweating, and alertness without you having to think about it. One side is like the accelerator. It prepares you for action. It releases adrenaline-like signals and tells the heart to beat faster and stronger. The other side is like the brake. It helps you rest, digest, repair, and sleep. At night, the brake should gently take over. But in many adults over 50, the accelerator keeps getting triggered. Why? Stress is one reason. But not just emotional stress. Physical stress matters too. Poor sleep, alcohol, dehydration, pain, reflux, low blood sugar, sleep apnea, certain medications, and even a heavy late meal can all send the body into alarm mode. Think of it like a smoke detector in a quiet house. The alarm may not mean the house is on fire, but it does mean something triggered the system. And after 50, the alarm can become more sensitive. Muscle mass declines, recovery slows, blood vessels may become stiffer, blood pressure may rise more easily, blood sugar may swing more dramatically. The body may not clear alcohol as smoothly, and sleep becomes more fragmented. So when you wake at 2 or 3 in the morning with your heart pounding, the question is not only, what is my heart doing? The better question is, what system just pushed my heart into alarm mode? Now, one of the most common nighttime triggers is alcohol. Many people believe alcohol relaxes the body because it makes them sleepy at first. But sleepiness is not the same as restorative sleep. Alcohol can fragment sleep, increase nighttime awakenings, affect breathing, and stimulate the nervous system later in the night as it is being metabolized. That is why someone may fall asleep easily after wine or liquor, then wake up hours later hot, restless, dry-mouthed, anxious, and aware of a pounding heart. This is especially important after 50 because the heart's rhythm system may be more vulnerable. Alcohol has been linked with episodes of atrial fibrillation, also called AFib, in susceptible people. AFib is an irregular rhythm where the upper chambers of the heart fire chaotically instead of squeezing in a steady, coordinated pattern. And this is where the story becomes more serious. Atrial fibrillation is not just a fast heartbeat, it is an irregular heartbeat. Some people feel it as fluttering, some feel pounding, some feel shortness of breath or fatigue, some feel dizzy, and some barely feel anything at all. But AFib matters because when the upper chambers of the heart quiver instead of pumping smoothly, blood can pool and form clots. those clots can travel, and that is one reason AFib is linked with stroke risk. Now, I want to be very clear. Not every racing heartbeat at night is AFib. Most palpitations are not a medical emergency. But after 50, new, frequent, worsening, or irregular palpitations should not be brushed off as just nerves, especially if they come with shortness of breath, chest discomfort, fainting, severe dizziness, or unusual weakness. Those symptoms deserve urgent medical attention. But what happens next matters most, because one of the biggest hidden drivers of nighttime heart racing is not caffeine, and it is not always stress. It is breathing. Sleep apnea is one of the most overlooked causes of nighttime heart stress after 50. Here's what happens. During sleep, the airway partially or completely collapses again and again. Breathing pauses. Oxygen drops. The brain senses danger and jolts the body just enough to reopen the airway. You may not fully wake up, but your nervous system does. And every time that happens, the body can release stress signals. Blood pressure can surge. The heart may beat harder. The rhythm system can become irritated. Imagine trying to sleep while someone keeps tapping the emergency button inside your chest. That is what untreated sleep apnea can do to the cardiovascular system. And many people have no idea it is happening. They may say, "I sleep 7 hours," but wake up tired. They may snore loudly. They may wake with a dry mouth, morning headache, or brain fog. Their partner may notice pauses in breathing. Or they may simply wake suddenly at night with the heart racing, feeling as if something startled them. This is why nighttime palpitations after 50 should lead to a sleep question, not only a heart question. Are you snoring? Are you waking up gasping? Do you feel exhausted despite enough time in bed? Is your blood pressure harder to control? Are you gaining weight around the belly? Are you waking to urinate several times a night? These clues matter because sleep apnea does not just disturb sleep. It can strain the heart, raise blood pressure, worsen insulin resistance, and increase rhythm instability. And this is the connection many people miss. Poor sleep can worsen blood sugar control. Poor blood sugar control can increase inflammation. Chronic low-grade inflammation can affect blood vessels and heart tissue. And over time, the heart's electrical system can become more irritable. Inflammation itself is not evil. Acute inflammation is part of healing. If you cut your finger, inflammation brings immune cells to repair the damage. That is normal. The concern is persistent low-grade inflammation, the kind that smolders quietly from poor sleep, excess visceral fat, uncontrolled blood sugar, inactivity, smoking, chronic stress, or untreated medical problems. That kind of inflammation is like a low internal fire. It does not always cause pain, but it can change how blood vessels behave, how insulin works, and how easily tissues recover. And after 50, recovery is everything. Now let's talk about another hidden signal, the thyroid. Your thyroid gland sits in the neck, but it acts like a metabolic thermostat for the whole body. Thyroid hormones tell cells how fast to burn energy. When thyroid activity is too high, the body can feel as if someone turned up the internal speed dial. The heart may race, the hands may tremble. You may feel hot, sweaty, anxious, weak, or lose weight without trying. But in older adults, thyroid symptoms can be subtle. Sometimes the main clue is simply an irregular or rapid heartbeat, fatigue, or unexplained weakness. That is why a racing heart at night should sometimes lead to a simple blood test, not just a sleep story or stress explanation. And the same is true for medications and supplements. Decongestants, some asthma inhalers, thyroid medication doses, certain antidepressants, stimulants, some weight loss products, and even energy supplements can push the heart rate upward. Too much caffeine can do it in sensitive people. But caffeine is more complicated than people think. Many assume coffee is always the villain. For some, it absolutely can be a trigger. But research and clinical guidance suggest that usual caffeine intake does not automatically trigger atrial fibrillation in everyone. Alcohol tends to be a more consistent trigger for many people with rhythm vulnerability. So the smarter approach is not panic, it is pattern tracking. Ask yourself, did the racing happen after alcohol, after a late heavy meal, after poor sleep, after extra caffeine, after a stressful day, after starting a new medication, after dehydration, after skipping dinner, after eating a very sugary dessert before bed? Your body often leaves a trail. For women, there is another important layer, hormonal change. During perimenopause and menopause, hot flashes and night sweats can come with a sudden sense of heat, sweating, flushing, anxiety, and a faster heartbeat. This can feel frightening, especially if it wakes you from sleep. But even here, do not assume every nighttime palpitation is just hormones. Menopause can explain some symptoms, but it does not protect anyone from AFib, thyroid disease, sleep apnea, high blood pressure, or medication effects. A good doctor does not dismiss symptoms because of age or hormones. A good doctor asks better questions. Now, what can you actually do? Start with the basics that give you the most information. First, when it happens, check the rhythm if you can. Is it fast but regular, like a drum beat? Or is it irregular, chaotic, uneven, like shoes tumbling in a dryer? That distinction matters. A fast, regular heartbeat can happen with anxiety, dehydration, fever, alcohol, or stress. An irregular rhythm raises more concern for arrhythmias like AFib. Second, write down the time, duration, what you ate or drank, medications taken, stress level, and any symptoms with it. This simple log can be more useful than trying to remember everything at a doctor's visit. Third, look at your evening routine. Keep alcohol away from bedtime, or avoid it completely if you notice a pattern. Do not eat a large, heavy meal right before lying down. Hydrate earlier in the day. Avoid suddenly overdoing caffeine, especially later in the afternoon, and be cautious with over-the-counter cold medicines or stimulant supplements. Fourth, take sleep seriously. If you snore loudly, wake up choking or gasping, feel tired in the morning, or have resistant high blood pressure, ask your clinician whether sleep apnea testing makes sense. Treating sleep apnea is not just about snoring. It may reduce stress on the heart and improve overall cardiovascular health. Fifth, do not ignore the medical check. Depending on your situation, your clinician may consider an EKG, blood tests for thyroid and electrolytes, a medication review, blood pressure assessment, or a wearable heart monitor that records rhythm over days or weeks. This matters because palpitations often disappear by the time you reach the clinic. A longer monitor can catch what a single office visit misses. And now we come to the most important point. The goal is not to fear your heartbeat. The goal is to understand its message. A heart that races at night may be saying, "You had too much alcohol." It may be saying, "Your nervous system is overloaded." It may be saying, "Your breathing is being interrupted during sleep." It may be saying, "Your thyroid is pushing your metabolism too hard." It may be saying, "Your blood sugar is swinging." Or it may be saying, "My rhythm needs to be checked." The danger is not noticing the signal. The danger is explaining it away for months or years without asking why it keeps returning. So here's the practical rule I give people. If it happens once, lasts only a few seconds, and you feel completely well, observe it and look for triggers. If it happens repeatedly, wakes you from sleep, feels irregular, lasts longer than a few minutes, or is new after 50, schedule a medical evaluation. And if it comes with chest pain, fainting, severe shortness of breath, severe dizziness, weakness on one side, confusion, or a feeling that something is seriously wrong, seek emergency care immediately. Food and lifestyle can support healthier biology, but they do not replace medical care for heart rhythm disorders, thyroid disease, sleep apnea, diabetes, or heart disease. And that is the real message of this video. Your nighttime heartbeat is not your enemy. It is information. After 50, the body often whispers before it shouts. A flutter, a pounding sensation, a sudden wake up at 3 a.m., a morning of unexplained fatigue, a blood pressure reading that is higher than it used to be. These are not reasons to panic, but they are reasons to pay attention. Because when you understand the hidden signals, you stop guessing. You stop blaming everything on age. You stop assuming anxiety is the whole story. And you begin seeing the heart for what it really is. Not just a pump, but a messenger connected to your sleep, hormones, metabolism, breathing, inflammation, and daily habits. So tonight, before you go to bed, think about the pattern. What changed? What did you drink? How late did you eat? How well are you sleeping? Are you waking rested? Has anyone mentioned snoring or breathing pauses? Has your doctor checked your rhythm, thyroid, blood pressure, or medications? Small clues can lead to big answers. And sometimes the most important step for your heart is not only taking a pill or cutting caffeine. It is finding the hidden stressor that keeps pressing the alarm button while you sleep. I'm Dr. Ryan Mitchell. If you have ever woken up with your heart racing, comment below and tell me what time of night it usually happens. Is it right after falling asleep, around 2 or 3 a.m., or closer to morning? Your pattern may matter more than you think. And if this helped you understand your body a little better, like this video, subscribe, and share it with someone over 50 who has been told it's probably just stress, when their body may be trying to tell a deeper story. Medical source note. Key points in this script are grounded in guidance from Mayo Clinic on palpitations and urgent warning symptoms, Cleveland Clinic on nighttime palpitations, NHLBI on atrial fibrillation symptoms, the American Heart Association on sleep apnea and AFib, Mayo Clinic on obstructive sleep apnea and hyperthyroidism, Cleveland Clinic on hot flashes, and Harvard Health on alcohol and caffeine as AFib triggers.